This is Dr. Duff Sprouls of the Space Coast Cancer Center describing for you what is radiation therapy. About 60% of cancer patients are treated with radiation at some point during their course of treatment. Radiation is the use of high-energy beams to treat the cancer. A radiation oncologist may use radiation to cure a cancer or to relieve cancer symptoms. Radiation therapy works because radiation destroys the cancer cell's ability to reproduce, and the body naturally gets rid of these damaged cells. Radiation affects cancer cells by damaging their DNA so that the cancer cells can no longer divide and grow. Radiation is the most effective at killing cells that are rapidly dividing. Cancer cells are more vulnerable to radiation for two key reasons. They divide more rapidly than normal cells, and they do not repair this damage as effectively as normal cells. A radiation oncologist may use external beam radiation therapy generated by a linear accelerator, a machine that accelerates electrons to produce X-rays or gamma rays. Proton therapy is another form of external beam radiation therapy that uses cyclotrons to produce charged atoms that destroy tumors. Radiation can also be given with radioactive sources that are put inside the patient, called brachytherapy. The radioactive source is sealed in needles, seeds, wires, or catheters and implanted directly into or near a tumor on a temporary or permanent basis. Brachytherapy is a common treatment for cancers of the prostate, uterus, cervix, and sometimes the breast. Some cancer patients may be treated with radiation therapy alone instead of surgery. Prostate cancer and larynx cancer are often treated in this manner. Sometimes radiation therapy is part of the patient's treatment. When the radiation therapy is used after surgery, it is called adjuvant radiation therapy. For example, a woman may have radiation therapy after breast-conserving surgery so that she can keep her breast and be cured of her cancer. Radiation can also be given before surgery and is called neoadjuvant or induction radiation, either to improve the cure rate or to make surgery easier to perform. Examples of this approach include the treatment of the esophagus, rectum, lung, or pancreas. Patients can be treated with radiation therapy and chemotherapy before surgery. Combined treatments may allow a patient to have a less radical surgery than would otherwise be required. For example, some bladder cancer patients can keep their bladder instead of having all of it removed.